So welcome to our module with our 63-year-old model, and today what we're going to be doing is exploring the issues around face shape modification, which is largely structural. However, we know that overall there tends to be more of a conformity towards a heart shape or an oval shape in an aesthetic ideal. She's moving towards a rectangle. Project, project, project and define, and then also to make a smooth curvature down towards the chin and also to narrow the chin slightly. There's very often a presentation here which is the malar mound or the orbicularis festoon. So touch the bone and inject, and what you're doing is you're hydrodissecting the DAO off the bone here. The upper lip and the lower lip and the relationship between the two should be a 1 to 1.618 relationship, and you finish with the vertical part of the star, which should only be the lower 2/3 of the filtral distance. You shouldn't go all the way to the top.